Hi everyone, I'm Anu Kathiresan, fertility physician and Dr. Mom, and here to educate on fertility. In this video, we'll be talking about supplements that can be considered in diminished ovarian reserve patients. First, I want to say, please see your healthcare provider and please see what would be recommended in your case. But having said that, here are some supplements that we sometimes will recommend in patients with diminished ovarian reserve. Number 1, take a prenatal vitamin. We want to make sure you're taking at least 400 micrograms of folic acid within your prenatal vitamin. It is okay if you're taking a little more. For example, some prenatal vitamins have 600 micrograms or 1,000 micrograms, and that is perfectly fine too. We just want to make sure you're getting at least 400 micrograms of folic acid. The point of that is to help prevent neural tube defects such as spina bifida. Now, there are certain circumstances where we may recommend more folic acid. For example, if a patient has had a history of a prior child with a neural tube defect, then we'll recommend more. So definitely talk to your healthcare provider about what would be recommended in your case. The other thing to keep in mind is we want you to start your prenatal vitamin 1 month before trying to conceive so that you already have the folic acid on board. Number 2 is omega-3 fatty acids. So what is recommended is 500 milligrams to 1,000 milligrams of DHEA, and this can sometimes also be in your prenatal vitamin. And this is helpful for fetal brain development. After the neural tube has been formed and patients are out of the first trimester, patients can still continue omega-3 fatty acids throughout the pregnancy. You could take that with your prenatal, or you can take a separate omega-3 fatty acid. Number 3, DHEA. There is a decline in testosterone levels with advancing age, and it's thought that this decline in testosterone may parallel the decline in fertility with advancing age. And DHEA is a precursor to testosterone. There have been some limited studies that have shown that DHEA may be associated with a modest improvement in ovarian response, and for this reason, DHEA is sometimes recommended in patients with diminished ovarian reserve. Number 4, CoQ10. Diminished ovarian reserve has been associated with a decrease in substrates for mitochondrial energy production in the egg, and this can lead to more errors with the division of the chromosomes in the egg and ultimately genetically abnormal embryos. There have been some limited studies in mice that have shown that CoQ10 has been associated with an increase in mitochondrial energy production, improvement in chromosome separation, and improvement in embryo development. Now, studies are limited on this. However, the overall risk is low, so CoQ10 will often be recommended in patients with diminished ovarian reserve. Other things that are good to keep in mind is a healthy lifestyle, diet, and exercise. In terms of diet, we usually recommend the Mediterranean diet, lots of fruits and vegetables, healthy fats like avocado, olive oil, minimizing red meat, sugars, processed foods, avoiding smoking, alcohol, and drugs, and also minimizing caffeine. In terms of exercise, we recommend a moderate amount of exercise. We don't want too much or too little, but just moderate amount, just overall trying to do what we can to stay healthy. For examples of some of the supplements we talked about, I will put a link down below. That is it for this video. I hope you found it helpful. If you did, I hope you'll give the video a like. Don't forget to subscribe down below. If you have comments or questions, you can leave them for me there also. Thank you again so much for watching, and see you in the next video.